Ellis Way campaign, and today we are talking about something really dear to this whole initiative, which is called the Ellis Way Pack. It's the care pack that we created to help health professionals and teams be able to deliver patient-centered care, which also helps to ensure patient safety. So, as this week we are celebrating Patient Safety Week, we thought this would be a really great time for us to talk about it and better create an understanding for teams to be able to use this in their care delivery. So I am Priscilla or Martin. I am the founder of the Ellis Way campaign, and I have with me our specialist nurse, Eva. Hi, Eva.
Hello, hello.
And we are going to just have a really important conversation about this and introduce it to everyone. So just stay with us. Hi. Um, okay, so this care pack has two things in it. We have the Look at Me, I Am Ellis, and that's a story I wrote, which is inspired by Ellis, my son's journey in hospital. It just narrates everything. Whenever I talk about it, it always makes me
It's
emotional.
here, right?
Yeah.
Yeah, it means a lot.
Yeah,
Yeah,
yes, it's a very dear story to me, and we shared it so that it will help other people also understand how important it is to see a child that you are caring for as who they are and not just to go through protocols and plans. So we'll be going through the book, and then what we created together as a care guide for health professionals to see beyond the child that you are caring for. But before we share that, let me just ask Ava,
yes.
when we talk about patient safety, what does it, how important is it for health professionals to see the individual they are taking care of? In this instance, the child that you are taking care of, how important is it for you to deliver patient-centered care?
It is it is the basis of everything you do as a
Yeah.
healthcare professional. That's where your treatments, your conversations should start.
Mm,
Getting to know that child or that patient and who they are. So then the care that you're providing, you
mhm.
can tailor it to benefit them in the best way possible. So it is critical to any healthcare professional dealing with patients.
Yeah, I
And I
I
think,
I totally
oh,
understand.
sorry, I was going to say, I think the Look at Me, I Am Ellis hones in on that perfectly.
Yeah.
Yeah,
I totally agree. I cannot agree with you more on that
yeah,
because I understand that sometimes I'm a nurse too. Let me just say so, but she is a pediatric nurse. Um, I sometimes we tend to see the protocols that have been placed down and how things have been done every time. And when you see things that way, sometimes you lose sight of the individuality and the uniqueness of the person that you are caring for.
that's right.
So yeah. So I think it's really important that we make sure we are delivering care that suits the needs of this patient that I am with. Because, I mean, the way that this one is and how they present and everything might be similar to this one, but might not totally be exactly what they need. Now, we'll just
Absolutely.
go through the book and some parts of it because the book is online. We've made it very accessible to everybody. It's free. We will put up the links for you to get it in your own time or after this when you watch. you can get it and then read it yourself. We'll just read some portions of it that talks about the need for the patient care.
Mm.
So, well, the at the beginning, this book was written in the eyes of Ellis. So that's how, even though he's a baby, but
Yeah.
just through the way he felt and what he endured, it was written through his eyes. So at the beginning, it says, "This is not just a story; it's a call to care differently. Thank you to all who see beyond the chart."
Mhm.
And I think this is very, very important because sometimes you might do that,
Yeah.
right?
Yeah. I
Yeah,
think it's a great perspective, and the way you've written it in the eyes of Ellis, it's a great way to look at it because like you said, with the policies and guidelines, sometimes it can be very, you know, one vision tracked, and you
exactly.
lose that moment of connecting with your patient and seeing things or their experiences from their point of view.
Yeah. Um, I love the spice. Says, "Hello, my name is Ellis. I'm small, I'm strong, and I love cuddles, music, and bright lights." This was
Mhm.
just me introducing who he is. I mean,
Yeah.
yeah. But let's dive more into the part that gets you to think about seeing more than just another baby or just another child that you are taking care of. So on this page 7, it says, "I was in the hospital a lot. I couldn't breathe the way other babies do. The doctor said I might need a special tube to help. They called it a tracheostomy, and mom was worried." And um, I mean, for every parent,
Mm.
when your child is not well, it's something that you never want to happen, even though we know that, I mean, as human beings, sometimes things, and you might not feel too well, but especially when it's a child, it's different. The
Yeah.
pain, the anxiety, the fear of what can happen and all that. So when your child is not well, and they are not well to that extent that you think they might need something else to assist them to breathe, something to assist them to walk, something to assist them to function in the way that um any other person who is well and good would
Yeah.
have to do. It's a lot to take in.
Mm.
And that is where I was worried at that time, because and I was worried because of this. The page 8 says Ellis's neck is different, and that was me talking to the health professionals. Ellis's
Mm.
neck is different. Please consider that. I don't want him to get hurt. And the professional said, "Yes, we understand." Now,
Which is something
as
really cool.
a specialist nurse,
Yeah.
when you're talking with a mother or a
Yes.
parent and you are taking care of their child, and then they draw your attention to something and say, this procedure that you're going to do, could you please consider this, because my child has this, and
Mm.
it's different, or it's not the
Mm.
normal way, or it's not how it is for everybody. What
Yeah.
comes into your mind with regards to patient-centered care?
I think a parent knows their child. I think one of the best advice I've ever received as a pediatric nurse was from my mentor, and she said,
Mm,
"You, as a nurse or a healthcare professional, you are here to care, and you might care with all your passion. Yes, there are limitations that make your job harder,
yeah.
but nobody loves or knows your patient like the parent
Mm,
does. So
yeah.
it's so important to really hear, and this links into our care guide, really
Yeah.
hear. Don't just, like you said, say, I understand and do nothing. You need to be proactive, like yourself when you pointed out the neck. Instead of saying, I understand and not doing anything, take that moment in time to
Mm-hmm.
have a look. like really look. And I think it's always important after you've done something proactive to check back in with the parent and see, do you feel like your concerns have been heard?
Yeah.
Like,
Yeah.
yeah,
Yeah.
it's important. It creates more effective care. So then
Yeah.
patients don't have to go through certain things.
Yeah. It's it really is because what was different about Ellis's neck was at that time he was really chunky.
Yeah,
He was chunky. He
yeah.
had a lot of rings under his neck.
Oh,
And his
yeah,
neck, you could barely see his neck. We used to
yeah.
joke, Ellis, you don't have no neck. His neck
Oh,
was like this.
yeah.
And it was so chunky. So that was my worry. And I kept telling them from the moment that they talked about the possibility of him having a tracheostomy in, I
Yeah.
kept telling them that I said, aside everything, I know my son's neck
Mm,
is something that needs to be taken really care of because even at home, and I
yeah.
told them all this, I said, even at home, when I give him a bath or anything, I need to make sure I have spread out his creases and
Mm,
cleaned in between really well so
mm,
it's dry.
mm,
Because I
mm.
mean, moisture and heat, they are not good friends. So
Yeah,
yeah, if you leave it there, it starts to get red, and
yeah.
then yeah. So I told him all that. I said that's what I'm worried about. Because for a child who has got that kind of neck and having a stoma and a tube there, that's a lot.
It's a lifeline.
Exactly. And then
Mm,
they kept saying, "We understand, we understand." I said, "Okay."
mm,
So when it got to the time that he really needed the tube, then
yeah.
I said, okay, but I expected the, like you said, because I had expressed my anxiety and my worries with regards to the tube going into a neck like that.
Mm, mm,
Maybe I also expected them to do something about it. I'll move on to the next page. But
mm,
after he had the tube in, this is what happened. Afterwards, my neck hurt. The tape was tight and I had pressure sores. I couldn't say it out loud, but my body told the story. I was
mm,
uncomfortable. I was in pain. If only they had looked at me, if only they had really seen me, my size, my shape, my special needs. And if they had listened and worked with my mom, maybe things would be different. And that's exactly what you said, because I felt like they listened, but they didn't hear
yeah.
me.
Yes.
They were listening, but they didn't hear me.
Mm,
And that cost my son a lot because
mm,
after he had the tube put in and he was taken back to the ICU, he later had really, really bad, like grade 3, grade 4 pressure ulcer all
yeah.
round his neck.
Yeah. Yeah.
And he was just, Ellis was like 4 months old. And that was dangerous.
Very. Yeah.
It was dangerous. And I still sometimes, so this whole campaign that I had to start, I just couldn't bear to see another child or
Yeah.
another family go through this.
Yeah.
And it's because when I shared with them what I thought would be a problem, nobody actually paid attention.
Mm, mm.
Because,
Whereas if they had physically acted on what you had mentioned in the beginning, all of that would
yeah.
have been avoided. And
Mm,
going with the patient safety, that's, I think we can easily say that that was a critical condition for
it
his neck to
was.
get to
It was.
before anyone
Yeah.
realized. Yeah.
Because I think sometimes when you do